And that's sort of a comment generally on American social perspectives. This methodological individualism is what we call it in disability studies. And when you do a cross-country comparison, for example, if you suppose you're injured in an accident, you have a spinal cord injury, in the U.S. it used to take you anywhere from 2 to 3 years to get through Social Security disability. And you talk about therapies, when you need it right after that accident, but in this country your employment is going to be tied to your health insurance. Right. And then, of course, now that you're injured, you don't have that health insurance, which many of our viewers may be now facing that crisis. But in other countries, such as in Germany, the day that accident happens, you're covered. But that's a choice that our societies have to make. And I know that right now, some of the people involved in Occupy Wall Street and Occupy Chicago are saying, well, we've been doing a lot for the top 1%, but how about the other 99? And then we go, what about those of us that are in the disability community? We could use a little help down here too.
Oh, yeah.
We have a student here at Candy King. He's a standout student, but because of former, and he's very vocal about former gang activity. He's in a wheelchair, was shot in this, and has a spinal injury. He is living with severe chronic pain for the last 18 years. He has because he can't. His insurance coverage won't cover the special surgery that he needs. So he is in severe pain every day of his life because of a lack of resources. And he's paid his debt to society. He went to jail. He did all of that. He's now a productive citizen, but there's just not enough resources out there. And it's really, when we talk about Obama's universal health care, I'm not quite sure where we are with that. We have a lot going on, but I'd like to see more in terms of disabilities, physical and the invisible disabilities.
And now, if maybe you could talk a little bit in terms of difference of gender, like how is disability impacted being a woman, which is usually considered a little bit softer sex than the male, so you being the more fragile, traditionally you've seen a lot of Tennessee Williams plays, the women fainting and all this, but then to have this physical impairment as a male is very different, and so if you could talk a little bit about that gender issue with respect to disability for both of your children, if you don't mind.
You have boys.
Yes.
Right? And I have a girl. I suspect there's not a lot of differences that we face. No. With our kids. I think. I do agree that. I can't think of anything I've had to deal with Molly that you haven't had to deal with your boys, and vice versa.
I think it's different. For some reason, autism hits boys more than girls.
Yeah, so it does, and sometimes more severely.
I believe so too, because my youngest son, he's nonverbal, he's 13, nonverbal behavior disorder, versus my oldest son, he's verbal and he can socially interact, but the spectrum levels are like night and day. But if you just take away the disability, just a 5-year age gap, it's still going to be a difference, as far as their personalities and different things of that nature. But I believe it's a difference, gender-wise, when it comes to autism.
One thing, talking about the fear of sex and all, it's possible that people looked at Molly, especially earlier in her life, as a much bigger behavior problem than they would have a boy who they expect acting up and so forth. That is one thing that that
kind of stereotypical
that you could be right about. Right.
Yeah.
So I just want to know, what do you all do for to decrease your stress level?
How do you remain a woman while you're, and try and maintain that aspect of your life while your child can take such a great deal of time?
What I do personally, like I said, I have an illness of my own. I have lupus, which is an autoimmune disorder, and I first became ill in 1999. And after a series of flare-ups, I came to the conclusion that I can't go out and work anymore. So I just dove into my passion of writing. I love writing. It started off as keeping a journal, and that's like real therapeutic, for me. So I believe with every parent that's in a situation of mine that's raising disabled children, is to find that niche, find what it is that they like to do, whether if it's just taking a nap or just taking a bubble bath.
Can I say something though about lupus? Per my understanding, stress often is a major cause of lupus. So we need to be. Is that true?
Yes.
Okay, so then you're raising the special needs kids. I mean, do you ever feel that may have contributed to you being diagnosed with lupus?
Right now, just like with autism, it's still under a lot of research. They're trying to link autism to the vaccinations Lupus is the same thing. It's still like a lot of research. They're trying to figure out if it's hereditary, or personally, I believe my stress caused it. You know, stress is like, you know, the
silent
underlying,
killer.
yeah, you know, it could be like the backdrop of any disorder.
Absolutely.
But personally, I believe stress caused mine, you know, but someone else may, you know, believe that, you know, some lupus is drug induced, you know, and some may be hereditary. So it's still like under a lot of research, you know, on how, you know, you get it.
Well, you know, what's funny, Sabrina said her outlet is writing, and I'm a journalist as well as a teacher and a lawyer, and so mine very well may be too. I have a column in our community paper in the South Loop, and I also do a blog, and I'm, you know, I do it fairly regularly, a few times a week. But I do remember an interesting thing that somebody once said to me. Years ago, I had a column in the Tribune, and a mother that I knew that had an autistic son said to me one day, you know, you're really lucky because you have an outlet. Okay, but I know that it is, you know, if you keep busy yourself, and also, you know, keep your autistic kids busy, and there are things to do, things I'm sure that your sons enjoy that my daughter does. You know, the days go by, and you know, you have a sense of satisfaction that you're doing things for yourself, you're doing things for your kids, and but it's rough.
Yeah, it is.
And I'm so used to it now. It's been, you know, like I said, Molly's 29, and so I've been at this for really 29 years, but I didn't know it until about 26 years ago.
Right.
Now, one thing we haven't touched on is the role of the dads, the biological fathers. Share a little bit about that and how your relationship has been affected by the child's disability, if you're willing to open up to us about it.
Molly has a good dad, very understanding, very indulgent with her, you might say, and he's always been there for her, and she spends a lot of time with him, and so, you know, all in all, at this moment, no complaints about that.
Okay, well, I'm a single parent, you know, so, you know,
I am as well.
You know, so mine is kind of like a double whammy. You know, I got to try to take care of myself in addition to taking care of them. So right now, I'm just, you know, basically just trying to find that balance, you know. So I'm sure it's a lot of, you know, people out there like me, you know, who, you know, the fathers are not, you know, actively involved, but yeah, you know, since you being the mom and the dad, you know, in addition to your own illness and your children, you just have to find that, you know, that balance.
And I am a single mother as well, but Molly does spend time with her dad, and he's always there for her. They do a lot of emailing together and that sort of thing too.
Talk about, Bonnie, your buddy system that gives you relief. Molly's buddy system.
Best Buddies is one of the programs that Molly's in, and has been for the last few years. And what they do is they pair up. They actually serve people with disabilities of all ages, but in Molly's program, the Citizen program, they'll pair up somebody with you who's, quote, normal, I hate to use the term, but you know, and your age, and you know, that has similar interests, and a friendship evolves, just like any other friendship, and they're, you know, they go out to eat, to movies, get together, at Best Buddies events and things, and that has been really, really good for Molly.
That's great to hear. I have a graduate student over at WYCC in the PhD Disability Studies program is actually studying that relationship and looking at both groups and see how they benefit. So I'm glad to see that.
I think there are benefits on both sides, for sure.
I said I would volunteer if I weren't so overworked. I'd love to be a best buddy to Molly, but it is a commitment. So more people, if you have time, I think it's a great program. And
the best buddies that they've paired her up with they're just perfect. You know, they really seem to study who would go with who, and they should go into the matchmaking business because they really seem to know who goes well with who.
Now I do have one more question. Again, if it's a very sensitive topic, that's okay. I know I ran across a video once by a group called the Empowered Fifis, and they talked about the bullying that these young ladies experienced when they were in school. And so I imagine children are so tough and on each other. And could you be willing to share any experiences, again, only if you're comfortable with it, about where your child was bullied in school?
I'll just say very briefly, Molly was always in special education. And so, you know, I don't think there's a bullying problem necessarily in a situation like that. She hasn't really experienced that
That's great.
which is always that I know of. I mean, you know, she did go to school when I wasn't there, and, but as far as I know, there was nothing like that. She's a very lovable young woman, and of course, it probably doesn't prevent bullying. But I think, you know, more often than not, people have been drawn to her and like her and want to spend time with her and haven't hurt her in any way, you know, that I know of.
And with my two boys, my youngest Cameron, he's in a therapeutic setting. So again, like you say, bullying is not an issue because he's in a special ed, you know, environment. Versus Kevin, he's always been normal classroom inclusion, but I've never had any issues with him, you know, being bullied because, you know, he got along socially pretty well.
Yeah,
so.
I think in the Chicago Public Schools, there's a real sense of, you know, there's not a culture for bullying as much as you hear in the news in other cities and other.
Exactly.
I just get that sense. I don't have any statistics or anything like that to back it up, but I get a sense that it's not as big a problem as it is in other places. That people are just more accepting of differences and diversity and so forth.
Right.
Now, is there anything else that you want to leave a parting thought for the audience as we leave Temple? Do you have a comment?
Really, if you're a parent watching and you're dealing with depression, denial, any of those types of things, if you don't have enough financial resources, talk to people. All it takes is talking to, meeting the right person. One person can change the course of your progression in your child or children's progression. And there's no need to suffer because luck and what's that saying? Luck and something happens to us all.
Luck and 25 cents will get you on the bus.
Right. Well, so, you know, if you have a special needs child, make the most of it. It's still a blessing. It's a child. So there's no need to suffer. And I think too many people are suffering. Too many parents, mothers are suffering, and fathers.
And Sabrina, do you have a thought you'd like to leave the audience with?
To all the viewers watching, as a parent, again, my biggest emphasis would be attend all the IEP meetings. If you have an IEP in force, attend all the meetings, network as much as you can, get involved with many programs as you can, because that will eliminate a lot of stress. And also too, it's important that, you know, you'll feel that you're not alone, because this can be isolating. And, you know, if you don't, you know, take advantage of the services that you do have, you only make the situation worse. So I just say just network as much as possible. But, you know, if you have an IEP in place, you know, for your child, definitely attend all the meetings as possible, because you're the only one, you know, as a parent, has your best interest, your child's best interest at heart. And actually the IEP is all about the parent and what they want for the child, because if you don't attend the meetings, you know, then the school system, they can make the decision for you. And then, you know, when they make the decision that you don't like, you know, you have nobody to blame but yourself. So.
And Bonnie, any wisdom from your 29 years?
You know, there was a movie on many years ago about a mother who had suddenly, you know, discovered that she had a disabled child. And I remember a line in this movie that has always stuck with me. And she said, you know, I started out on a journey to wherever, but I ended up somewhere else. And that was okay too. And I've always thought of that, you know, I have been on a very unusual, unexpected journey, but it's okay too.
Thank you all. Our strengths may not be all equal, nor the challenges we face in our daily lives, but the goal of equality, the aspiration for a society that values a fair shot for all at a good life, is something that we can all value. For the professors, I'm Antonio Vasquez.